Hello, and thank you for joining today's session on medical marijuana in peripheral neuropathy treatment, presented by the Foundation for Peripheral Neuropathy with guest speaker, Dr. Jessica Robinson-Papp. My name is Lindsay Colbert, and I am the Executive Director of the Foundation for Peripheral Neuropathy. On behalf of my staff, the Board of Directors, and the Medical and Scientific Advisory Board, I want to thank you for participating in today's session. I hope that you will find this information helpful as you navigate the potential use of medical marijuana in your treatment plan with your medical care team. Before we kick off today's session, I just want to remind those of you joining us live of a couple of items. Yes, we are recording this presentation and we will share the recording with you via email, and it will also be posted on our website for future reference. The slide deck that is accompanying today's presentation will also be uploaded to our website. If you have any questions pertaining to this topic, please submit them at any time via the questions box on your GoToWebinar dashboard. Please remember to not submit any personalized medical questions, as we will not be able to answer those during our program. We will try to address as many questions as we can at the end of the program. And now I am pleased to introduce our guest speaker for this session. Dr. Robinson-Papp is a practicing neurologist and clinical researcher. She studies peripheral neuropathies, chronic pain, and the neurologic complications of HIV, including autonomic neuropathy and HIV-associated neurocognitive disorder. She is the Vice Chair for Clinical Research in the Department of Neurology and the Director of the PAIRED Project and of the Mount Sinai Autonomic Laboratory. A nationally and internationally recognized researcher, Dr. Robinson-Papp has been funded by multiple grants from the National Institutes of Health and the Agency for Healthcare Research and Quality. Her expertise has been recognized for her inclusion on numerous committees and advisory groups. Clinically, Dr. Robinson-Papp directs neurological care and pain management services for people living with HIV within Mount Sinai's Institute for Advanced Medicine. She also performs electromyography, autonomic testing, and intraoperative neurologic monitoring to aid in the diagnosis of neurologic disorders. And without further ado, I'd like to invite Dr. Robinson-Papp to join us and pass the virtual mic over to you. Thank you again.
Thank you so much, Lindsay, for that kind introduction. It's a pleasure to be with everyone here today. So let's get started. So today we're going to be talking about the use of medical marijuana for the treatment of symptoms of peripheral neuropathy. And I like to just sort of start out by getting us all on the same page, because there's a lot of different terminology and words out there that people use when they're talking about medical marijuana. So cannabis is a botanical name. It's the name that we refer to the plant as, and it's one of the oldest known cultivated plants. So human beings have been using it for a really long time. And within the cannabis plant, there are two main varieties that have two different general uses, and we refer to those as hemp and marijuana. Marijuana is used for recreational and medicinal purposes, and it has lots of different active compounds in it, which we'll talk about a bit more later. But there are two that you'll hear most about, and those are also both called cannabinoids. That's just the class of compound that they are. And there are two main ones of those, although there are many, and that's THC, which has the psychoactive component of marijuana, and CBD. Now, the designation of a cannabis plant as either hemp or as marijuana is somewhat arbitrary, and it's a legal definition. So by definition, any cannabis that has a very, very low THC level, less than 0.3%, is hemp, and any other cannabis is marijuana. And hemp has traditionally been used for industrial purposes. So particularly in colonial times and a little bit more recently, the hemp plant was used to make things like rope, clothes, and food items. Whereas medical marijuana has a lot of variability in what people refer to it as. So there is medical marijuana itself, and the definition of medical marijuana varies depending on the state that you're in. Sometimes it can be a marijuana plant itself. Sometimes it can be a product that's manufactured from the marijuana. And then we also have CBD products that are made from hemp, which also can have potentially medicinal qualities. And then we have pharmaceutically manufactured cannabinoids. So these are things that are not coming usually directly from the plants themselves, but they're things that are manufactured by pharmaceutical companies, but are based on the chemical structures of the natural cannabinoids. So we have in this country, we have two versions of synthetic THC that are available on the market and FDA approved. And then we also have a pharmaceutical product that is derived from the actual cannabis plant, and that is Epidiolex. Unfortunately, that's not something that is typically available to patients living with neuropathy. It is FDA approved for the treatment of epilepsy only. However, outside the US, in Canada, and also in most of Europe, there is a product that is used for pain, which is called Sativex. That's a natural product. I also like to mention on this slide the idea of synthetic cannabinoids or synthetic marijuana, sometimes referred to as fake weed. When people buy marijuana off the street, it can have a lot of contaminants in it and can be very unsafe. And then there are also these products out there that are marketed as synthetic marijuana that have nothing to do with marijuana whatsoever and are really usually some kind of tobacco sprayed with some kind of unregulated chemical. And we have had, particularly in New York City, where I work, some sort of waves of patients coming in with all kinds of neurologic problems from these products. So these have, I'd just like to mention them to distinguish them because they have no medicinal use and are actually quite dangerous. So I mentioned that cannabis is one of the oldest cultivated plants, and it's been used as a medication actually for thousands of years. The first known reference dates back as far as about 2000 BC, and it's been present in multiple cultures and throughout the ages. So one reference that's an early one, a written reference, is from 1700 BC, which talks about medical marijuana as a treatment for the eyes that could be used to help with vision. In 1640 AD, it is referenced as a good treatment for pain due to gouts or tumors or knots in the joints. And they talk about how the medical marijuana could be burnt by fire, or it could be mixed with oil or butter, which is actually how most edibles are still made to this day, because the cannabinoids do not dissolve well in water, and they have to be dissolved in an oily substance. And then you can see over here different ways that medical marijuana has been written in different languages. Marijuana also has a very storied history in our own country. It was used, as I mentioned before, in colonial times. It was encouraged, its cultivation, because it was a very useful plant, and people would use it to make things like rope and cloth. And the marijuana was also an ingredient in many medicinal products. And it was a completely unregulated substance actually until 1906, when the Pure Food and Drug Act required the labeling of products that contained marijuana. So this was the very first regulation. And then in the ensuing decades, there was an intensification of anti-marijuana propaganda. There was a sort of classic propaganda film called Reefer Madness that showed all the bad things that could happen to you if you smoked marijuana. And this kind of demonization of marijuana continued and probably peaked in the 1970s and 80s. In the 1970s, there was the Controlled Substance Act, and marijuana was designated as a Schedule I controlled substance. That is sort of up there with the likes of heroin, and it means that it was designated as a drug with currently no acceptable medical use and a high potential for abuse. This designation at the federal level actually still exists, which is sort of an interesting dichotomy since most states have now changed their laws. So state and federal law actually contradict each other on marijuana, and I'll talk about that a little bit more. The 1980s saw the war on drugs and the 3 strikes you're out rule, where you could have life sentences for repeat drug offenses, even if they were only marijuana. Then in the 90s, things sort of started to change. The first legalization of medical use was in California in 96. The first legalization of recreational use was much more recent, 2012. And then in 2014, there was a federal law that was passed that barred the Federal Department of Justice from spending any money to interfere with the implementation of state medical cannabis laws. So while medical cannabis was still illegal at the federal level, this basically meant that the federal government couldn't prosecute any of the states for their laws, even if they conflicted with federal law. So that was very important. And then 2018 was sort of the last big legislative change. This was at the federal level. This was the Farm Bill that came out that made hemp-derived CBD products legal at the federal level. And this, if you recall, back in 2018, was the time at which you started seeing CBD everywhere, CBD flavored water in your local CVS. That was a huge, huge growth in CBD sales at that time. So we're in this peculiar situation where state and federal law conflict, and the state laws are extremely variable. So when I give this talk in my home state of New York, I can be a lot more specific about what is allowed in New York, but it's really very different state by state, and it changes all the time. So the green states are the ones that have both recreational and medical marijuana as legal. The blue states are the ones that have just medical as legal. And then the gray states are the ones that don't have any additional laws other than the federal law. And so they have as being legal only the hemp-derived CBD products. So what is in the marijuana plant that might be medicinal? So it's like most natural substances, it's a very complicated soup of different things that are in it. We know that there are at least 400 different chemical entities within the natural marijuana plant, and 60 of these are defined as cannabinoids. And cannabinoid just refers to the general structure of the molecule, which you can see over here on the right-hand side of the screen. So there are 4 major cannabinoids. There are obviously a lot of them, but the 4 that are most well studied are these here. And among these 4, probably the delta-9 THC and CBD are the most well understood, and their structures are here. So THC has the major psychoactive effects. It can cause people to have hypoactivity, hypothermia, and some spatial, verbal, short-term memory impairment, that feeling of being high. And CBD does not really have those kinds of psychoactive effects on its own, but there's some idea that it might potentiate the psychoactive effects of the THC. There are also entourage compounds. So we said that there are over 400 different things in the marijuana, and the 340 or so of those that are not cannabinoids we refer to as entourage. And those are in 2 major classes, the terpenes and the flavonoids, again, sort of defined by the chemical structure that they have. So in order for cannabinoids to have an effect on our bodies, they have to be perceived by a receptor, and those are the cannabinoid receptors. They were discovered in the 1980s and researched more in the 1990s, and there are 2 main cannabinoid receptors, receptor number 1 and 2, and they are there for the purpose of binding our own body's endogenous cannabinoids. So our body does make its own cannabinoids that are the natural binder of these receptors. But they also bind the cannabinoids that are present in medical marijuana. And the effect of a given cannabinoid, like THC versus CBD, depends on which receptor it preferentially binds and how tightly it binds that receptor. So the cannabinoid receptor number 1 is mostly in the brain, and THC binds that cannabinoid receptor 1 most, which accounts for the psychoactive effects of THC. And the cannabinoid receptor number 2 has a more broad distribution. It's present in some of the peripheral nervous system, like nerves, but it's also part of the immune system. And CBD binds this second receptor more, which is why it's thought that CBD has some anti-inflammatory and immune type effects. So here's a graphic, sort of a bit simplified, but a nice kind of ballpark of some of the different effects that are known about THC and CBD. Most formulations of medical marijuana that are not the plant itself will have either more THC or CBD, and I'll show you a little more about that in a bit. But in general, here are some of the differences in effect. So CBD has been proven to be an anticonvulsant. It is FDA approved for the treatment of certain seizure disorders. THC is a bit stronger as a muscle relaxant, so it's used for the treatment of spasticity, so increased muscle tone. CBD can be used as an anxiolytic, so against anxiety. THC is probably not the best for anxiety because it actually makes some people feel more anxious, although it sometimes can evoke paranoia in some people, but some people do also find it calming. Antiemetics, so working against nausea and vomiting, particularly in the setting of chemotherapy, both THC and CBD can be helpful for that. THC is more sedating, so some people use it for sleep. THC is more of an appetite stimulant, so people use it for that purpose as well. And then also it can increase gastrointestinal motility. So for people who have slowed gastric emptying, it can be helpful for that as well. So what about those other compounds that make up the entourage compounds? Well, the short answer about that is that we don't really know for sure what they do. It's highly likely that they have some kind of biologic or medicinal activity, but the research just isn't really in place yet for us to know what they do. In states where recreational marijuana particularly is legal, there is a lot of marketing within the marijuana industry around these entourage compounds. And different strains of marijuana will be marketed for different uses. If you go into a dispensary, they might say that, oh, this one is good for X, Y, and Z, and that one is good for something else. And a lot of those ideas are based on the differential composition of these entourage compounds. So those claims are mostly anecdotal, so they come from the experience of the dispensary or the experience of patients. We don't know for sure that they're false. We just also don't have good, rigorous scientific data that those claims are true either. So what kind of rigorous scientific data do we have? There's been a fair amount of research in the cannabinoids and their effect on the body in lots of different kinds of medical conditions, including peripheral neuropathies and neuropathic pain. And that research has been done in a variety of different forms of cannabis. So some was done in the cannabis itself, some was done in these more medicinal products that are purified forms of THC and CBD, and then some are done on the pharmaceutical cannabinoids. So this here is a research article that was published pretty recently in the last couple of years that was a meta-analysis and systematic review. And so what that means is that these authors did not do any original research in this article, but what they did was try to gather together in a very systematic and controlled way all the other studies that had been done on medical cannabis or cannabinoids. And in this case, they were focused on chronic non-cancer and cancer-related pain. And so to summarize, what they said was that there was moderate to high certainty evidence, so that that means that the clinical trials that were performed were rigorous and well done. And that showed that over sort of an averaging effect over all of these trials in general, medical cannabis or cannabinoids did result in at least a small increase in the proportion of people living with chronic pain who experienced an important relief in pain and an improvement in physical functioning or sleep quality. So within this article, there were a number of the trials that focused specifically on neuropathy and neuropathic pain, and you can see them here in this table. I thought I'd just highlight one that was sort of one of the larger studies with 246 participants. This was a study by Serpil and colleagues. It was a double-blind, randomized, placebo-controlled, parallel group study of a THC and CBD spray in peripheral neuropathic pain. So this was a study that was done in Europe. It was large. There were about 300 patients, and they all had neuropathic pain, but they were allowed to have neuropathic pain of different kinds. So some people had peripheral neuropathies related to diabetes, for example. Others had more complicated neuropathic pain syndromes, for example, complex regional pain syndrome, which is also sometimes called reflex sympathetic dystrophy, or RSD. And so they randomized people to either get the active spray, which had both THC and CBD in it in a 1-to-1 ratio, or a placebo spray, and then they followed them out over time. And what they found was that the participants who got the active ingredients seemed to have a better response in terms of their pain than those who had placebo. And this is shown over here in this graph, separating nicely the group that got active versus the group that got placebo. And they used a primary outcome of a 30% response, which is a pretty standard outcome, which means, like, did your pain score go down by at least 30% of where it was at the beginning? So I'm going to touch a little bit on sort of the nuts and bolts of what might be out there in terms of cannabis products. As I said, it varies a lot state by state. So we're going to start with the hemp-derived CBD products because these are legal on a national level. So everyone has the same access to these. So CBD is as derived from hemp is basically an agricultural product. So hemp, as I mentioned before, is any cannabis plant that has a very low THC concentration. So these are usually strains that have been bred to have the low THC, so they comply with the law, but to try to have higher CBD levels. However, that's sort of difficult to do, so it still requires a lot of these plants to extract the amount of CBD that you might need to make a medicinal product. And in the process of this, there is a potential for contamination with pesticides that are used on the hemp, microbial contaminants like mold or bacteria, and then also heavy metals. So hemp is a bioaccumulator, which means that if it's planted in soil that has like lead in it or other heavy metals, it can kind of suck that up out of the soil and get it into the plant and then subsequently into the medicinal product. And then you have to use solvents to get the CBD out of the hemp plant. And so there can be residual solvents in the products as well. So while there is a lot of hemp-derived CBD available out there, mostly on the internet, the quality varies a lot, and it's not a very well-regulated industry. And there was, a lot of news media several years back about this article here that was published in USA Today, where they actually took a lot of they took a sampling, I think, of about 200 different CBD products that were available online. And they particularly focused on CBD products that somebody had complained about. So it's a biased sample. They were really looking for the ones that people thought were funny in some way. And they did find a lot of contamination with different things, including some of them had fentanyl in them, which was a little bit crazy. Fortunately, there are ways to distinguish the good from the bad products. There is a group called the U.S. Hemp Authority. It sounds very official, but it's not actually part of the government. It is a self-regulation group, so it's run by the hemp industry, so you have to take it a little bit with a grain of salt. But they do have on their website a very standardized way by which they evaluate hemp producers, and then they will certify them as having passed this level of scrutiny or not. And so that at least lets you know that this particular producer has a certain amount of credibility. And then the other thing that you can look for if you're buying a CBD product online is a certificate, like an analysis certificate, a certificate of analysis. And so what that will show, and they usually have dates on them, so you want it to be a recent certificate as well. And it will have different components. So this is an example of one that's good. It's what you want to see. So it's a little small on my screen, but I hope you can see it. So here it shows all of the different cannabinoids that might be in that product. And so what you want to see is that CBD is what it's mostly made out of. So this is a good one, right? It has 99% CBD by weight. It does not have any THC in it. You want to make sure that it has no heavy metal contamination, right? So here, arsenic, mercury, and in this particular sample, these were not detected, so that's good. And then it also tests for bacteria and fungus, and those are negative as well. So less than 100 is negative in this assay. So this helps you to be a little bit confident that this is a good product, because there's certainly an enormous array of products out there. Here are just some of them that you might see. You know, there's CBD water, there's CBD gel, there's gummies, all kinds of different things online. So you want to make sure that it's a reputable product. So I practice in New York State, so I'll give an example of some of the products that are available in the New York State program. Programs vary state by state, but the general kind of formulations that are available are probably similar in some other states. So I'll just go through them there and some of the information that's necessary to make a decision. So in New York State, we have both medical and recreational programs. Our recreational program is called adult use program. I think they don't like the word recreational. In general, and particularly in New York, both of these programs are very tightly regulated and inspected by the state, so that the product should be trustworthy. And for New York State, we have a New York State governmental website called the Office of Cannabis something, I think it's Cannabis Affairs, that gives very detailed information about how they oversee their programs. So you may, in your state, be able to find something like that online as well. Our website in New York State lists all of the legal dispensaries, both in terms of the adult use and the medical program, so you can see which ones are legit. And our medical program is a bit stricter. So what has to happen in our state medical program is that a patient has to get certified. They do that by coming to a provider who's allowed to give that certification. In New York State, doctors, nurses, NPs, PAs, dentists, and midwives are allowed to go through a special training and then once they're completed that training, they can sign up their patients for medical marijuana. It doesn't make a lot of difference anymore in New York State because, you know, we have this adult use program and it's safe and well regulated also. But right now, I think the patients who are mostly wanting the medical certification is for two reasons. One is if, you know, their employer requires evidence that they're used, if they have a positive urine toxicology, that it's for medical purposes. So that can be helpful. And then also medical, at least in our state, is better for people who want very precise and consistent dosing. So our medical program in New York State has like precise milligrams on the products, on most of the products that they sell. So if you want to make sure that you're always getting exactly the same thing, then that can be very helpful. So in general, there are 3 routes of administration for medical marijuana products. One is the inhaled route, one is the transmucosal route, and one is the oral route. And I'll go through each of those in a little bit of detail. So they all have pluses and minuses. So the inhaled route, the main minus there is you're exposing your lungs to, if it's smoked, obviously you're exposing your lungs to smoke, which is not the best for our health. Sometimes it comes in a vape pen, and there's been some concern about the health effects of vaping, so there's that. Probably the safest way of the inhaled route are these vaporizers that are available, and I'll show you a picture of that on the next slide. But those are a little bit cumbersome. They're these kind of like large devices that are not very portable. The onset is the fastest with the inhaled route. People will feel the onset almost immediately, and the duration of effect is the shortest, so 1 to 2 hours. The transmucosal route I find is preferred by most of my patients because it's kind of a nice middle ground. So transmucosal means it's being absorbed by the mucosa in the mouth. So usually it's either a spray or a little dropper that has some kind of a tincture or an oil in it. And so you can put a little drop under your tongue. It has to stay in the mouth in order to be absorbed that way. If you swallow it, nothing bad happens. It just doesn't get absorbed as much. This has sort of a middle ground of onset, 2 to 15 minutes, and a middle ground of duration of action, 4 to 6 hours. The oral route, some people like as well. So within many of the medical programs, the oral route includes things like pills, capsules. It also includes things like in certain states where edibles are illegal, it'll include the edibles, gummies, things of that nature. The downside of oral potentially is that it requires a much higher dose because when cannabinoids are absorbed through the stomach and the GI tract, they go through something called first pass hepatic metabolism. So the liver is right next to your GI tract. So when anything is absorbed into the blood from the gut, it often will pass right through the liver before getting circulated to the rest of the body. And the liver will actually break down a lot of the cannabinoids before they even get to the rest of your body. So the doses have to be higher in the oral route. The other possible concern with it is that the duration, the onset of action is slower. So I have had patients take too much because they are waiting for something to happen and think that that they've taken too little and nothing has happened. And then all of a sudden they realize, uh-oh, I've taken a lot, because it all starts kicking in later than they might expect. The normal onset is 1 to 2 hours, but everybody's different. It depends on GI motility. And sometimes people with neuropathy may have slowed motility through the gut, so the absorption may be a little bit different. It's also much longer duration of action, so it depends on whether that's a plus or a minus, and that it depends on the individual. So here are just some examples of products that are available through the medical program in New York State. I think a lot of these are similar in other states because a lot of these companies operate in multiple different states and not just New York. So just some examples. We in New York State have things that just look like straight up marijuana or marijuana cigarettes. That was sort of been a more recent development in New York State. This used to not be illegal, but now it is. You can see things here like tinctures, lozenges. This is sort of a very medicalized product, right? A little pill bottle, sprays. This is that vaporizer that I had mentioned. So it's like a volcano where you can put these little pods that almost look like coffee pods into it, and it will vaporize the CBD without, or rather the cannabinoids, without raising them to the temperature at which they burn. So you're getting a vaporization of the CBD without inhaling smoke. And then there are some products that are specially engineered to be able to dissolve in liquid if people want to drink them kind of like a tea. So people always ask about dosing, and this is hard to answer because a lot of the research that has been done on things like smoked cannabis cigarettes that don't always have an exact kind of dosing that you can get at. But there has been, just a couple of years ago now, the need for this was recognized, and a panel of experts came together to at least give some consensus recommendations on how to go about trying cannabinoid products and the order in which to do so. So the main kind of guiding principle here is start low and go slow. But you can see here that this consensus guideline recommended the following. So they recommended to start with CBD predominant formulations because those usually have very few side effects, and that a reasonable starting dose would be, and this is for oral, would be 5 milligrams twice per day. And then if that is not effective, then there can be a CBD titration. So 10 milligrams per day increase every 2 or 3 days. If then you get to a point of having 40 milligrams of CBD, but that's still not effective, that would be the time at which to potentially try adding the THC, starting with a dose of 2.5 milligrams per day, and then increasing by 2.5 milligrams per day every 2 to 7 days until the goals are met, or a dose of about 40 is met. Above 40, probably not a lot more efficacy, and then greater potential for side effects. Usually this is twice a day dosing. The oral formulations last about 8 to 10 hours, so that would be within a twice a day kind of range. The other formulations, if it's not oral, are going to be much lower. We have here some recommendations for the transmucosal spray. So Sativex is a 1-to-1 THC to CBD transmucosal spray that is available as a pharmaceutical product in Australia and Europe and Canada. So it has like an official labeling instruction there. We have similar products available, in our state programs, but we just don't have this particular product. And you can see here the dosing that they recommend. So for Sativex, one spray is about 2.5 milligrams of THC and 2.5 of CBD, so about even. And in the Australian packaging, for example, they give this titration schedule as recommended. So for example, on the first day of dosing, they recommend taking one spray in the evening and no sprays in the morning, doing that for 2 days, then increasing up to 2 sprays in the evening, then if needed, increasing up to 1 in the morning and 2 in the evening, and so on and so forth, so that by the end of 2 weeks, you're at something like 13 milligrams of each in the morning and, between 17 and 18 in the evening. So just an idea of what some of the dosing ranges are. And with that, I'm going to stop and leave time for questions.
Great, thank you so much. This was super helpful. We do have a lot of questions that came in, so I'm going to just start rolling those out, and hopefully we can get through as many as possible.
Sounds good.
Great. So other than reducing pain, does medical marijuana have any other use in the treatment of peripheral neuropathy?
That's a really good question. So it's mostly going to be a symptomatic therapy. So reducing pain is the goal, increasing sleep, increasing physical function, but those things are all kind of like secondary probably to the reducing of pain, right? If you have less pain, you're going to be able to sleep better, you're going to be able to function more. Whether it has any effect on like the actual underlying neuropathy process, like the degeneration of the peripheral nerves, we don't really have information that it does. We don't really have good information that anything really helps the peripheral nerves, unfortunately, come back in a consistent way across disease states. There is some notion, at least, that the CBD may have some anti-inflammatory properties, which potentially might be helpful, but we just don't really have that information.
There are a lot of articles out there. I know a lot of our patients, and even one of them commented earlier during your presentation about information on nerve regeneration and medical marijuana. So could you maybe elaborate a little bit more on that, or maybe speak to some of the false studies that might also be out there that people should be mindful of?
Yeah, I think that part of it will depend, because people have neuropathy for different reasons, right? So the original inciting event that caused the neuropathy will, depending on what it was, the role of inflammation in the development of that neuropathy can be very different. So, for example, there are neuropathies that are overtly inflammatory, right? They're caused definitely by neuropathy, by inflammation, like CIDP. But and some of like the vasculitides, but those tend to be the rarer forms. The more common forms, the ones that are like, for example, due to diabetes, or the ones that are idiopathic, like we don't know exactly what causes them, or thyroid disease or B12 deficiency. Those neuropathies, inflammation has a lesser role to play. So, suppressing that or reversing that, there just isn't really good data that that's going to result in nerve regeneration. It's possible that it would help, but I don't think that the data really supports it yet.
Okay. What are your thoughts about a schedule when it comes to patients taking medical marijuana for pain relief? Is there a particular schedule that folks should consider every day at the same time, or perhaps once a week on the same day? And obviously it depends, of course, on their personalized treatment plan, but Could you talk a little bit more about what you've seen when it comes to scheduling to make sure that patients are getting the most effective, kind of seeing the most effective results from use?
Yeah, I think that there's sort of two main strategies that people take with pain management in general, and it partially depends on the goals of the individual and also symptom severity. So and those two general buckets are, people who want to only take something as needed, and that might be appropriate for people whose pain is not so severe, or people who have very intermittent kind of spikes of pain, but then it goes back down again. Some people with neuropathy are like that, where the pain is like super variable. And then other people have pain that is either more severe or more constant. If you're in this sort of second group where it's more severe and more constant, then those people tend to want something that is kind of provide a base level of pain control. And then they might also have something additional for as needed use. In those scenarios where you want something that's going to cover kind of a base level, it depends on the route of administration. So if you're using something oral, then twice a day is kind of reasonable. If you're using something that is transmucosal, that's a spray, then it's going to have to be more frequent, because it usually only lasts about 3 or 4 hours. So then you'd have to be using that throughout the day. So, but those are really good. The shorter acting ones are really good for those spikes of pain. So what you might do is have an oral formulation that you're taking kind of on a basal level, and then a different formulation like a transmucosal to use as kind of like a breakthrough sort of treatment, or an as needed type of treatment. It's often a process of trial and error also, and sort of what time of day it is and what you have to be doing. So some people will have mixed products with CBD and THC in it for nighttime, or for when pain is very severe, and then CBD products alone for daytime or for lesser pain, when they really want to make sure, or when they're driving, they want to make sure that they're alert and aware, then they might mix it up that way.
And do you typically try to consult your patients about other medications that they're taking, and to be mindful of those types of potential interactions? Obviously, a lot of our patients are either on Lyrica or gabapentin or some other type of pain-reducing drug, and adding this into the mix, how is that encouraged? Is that discouraged? Or how would you generally navigate that type of concern or question?
Yeah, that's a really great question. So with the gabapentinoids, like gabapentin and pregabalin, there's no direct drug-drug interaction between the two of them. So it's not like one is going to make the level of the other one higher, or cause any specific toxicity. But particularly with the THC formulations, they can both be sedating. So some people find Lyrica, pregabalin, and gabapentin pretty sedating, and then the THC could add to that. So you have to be concerned about that potentially. So again, it's sort of like a start low, go slow kind of approach to that. There are so your doctor and actually patients as well, there's lots of different apps out there that will show you kind of drug-drug interactions, and websites as well. The one that I think most physicians use is Up to Date, but it has a subscription fee to it.
Okay.
I know there are some free ones as well. So some of them will have cannabinoids in them, so that can be really helpful. But all of them have, and some of them will have Sativex in them, even though it's not an American product. It is available in Europe, so that's a pharmaceutical, so you could actually put it in, and that will show you THC and CBD, and drug check it with other medications. And then if it doesn't have that, the American thing that we do have is that has THC in it is Marinol. Okay. And the thing that has CBD in it is Epidiolex. So if you wanted to run a drug-drug interaction check with any of your personal medications, you could just throw in
Marinol, Epidiolex, and then your medications, and then you would see what it potentially interacts with.
Interesting. Okay, that's very helpful. Thank you. So how do you recommend patients navigate the type of marijuana to use, whether it's, smoking it, digesting it like with a gummy, a cream, which I don't think you really necessarily spoke to specifically, right? So how would you navigate which one you would be the most effective depending on the symptom that you're experiencing?
Right. So I think I didn't talk about the creams. I think topicals are fantastic because they're like the safest, right? So usually they're not super systemically absorbed. So they will, if they work for a patient, then that's great because they're just going to be localized, and when the reason that you might use that in neuropathy too is that some people have really focal neuropathies, right? Like maybe it's just the bottom of the feet, in which case like putting a topical CBD or some kind of product like that, if that's effective, then that's a great place to start. How I counsel people on how to start and route of administration, I think the first question I ask folks is, whether they are marijuana experienced or not. A lot of my patients, I mainly take care of people living with HIV, and they have HIV-associated neuropathies. And in my patient population where I practice, most people who are asking for medical marijuana have experienced marijuana themselves recreationally in the past, and so have a good idea of how it affects them and have a good idea of how they want to use it. If folks don't, I do actually generally kind of follow that flow chart that I showed in one of the slides, where I'll say well, let's try. I usually start with like a CBD alone spray, because smoking is kind of not great for your health, and would like to avoid that if possible. And the spray is nice because it will act pretty quickly. So within 2 to 15 minutes, you're going to understand how it's affecting your body, and it's not going to hang around forever either. So if you really don't like how it's affecting your body, then it will be gone, in an hour or a couple of hours. So I would usually recommend, starting with that. Start with the CBD alone spray. Do it. It shouldn't have any psychoactive effects, but everybody's different. You never know. So, use it on a day when you don't have to do much. You're home. It's a weekend. You can see how it affects you. And then, have a conversation with your provider about up titration from there.
Got it. And should folks at all be nervous about addiction when it comes to using medical marijuana for this type of symptomatic treatment plan?
Yeah, that's a really good question. People are addicted to marijuana. That exists. There's cannabinoid use disorder. It is not one of the most addictive substances out there. It's certainly safer than, less addictive probably than alcohol, nicotine, and certainly than opioids. But it's not perfectly safe.
Okay.
CBD alone, I think, really does not have much of a potential for addiction, just because it doesn't have, all substances that have a potential for addiction have the psychoactive effect, and CBD doesn't really have one. So I would be pretty unconcerned about that. And it also depends on who the person is and what their own history is. So there are certain risk factors for developing an addiction to any substance. So, very young people are at risk because, they don't have a lot of track history in the past with substances, so you don't know what their interactions with them would be. So, certainly, and I don't take care of pediatric patients, but, people in their teens and early 20s, you would want to be more concerned. Older folks usually have experienced in their lives, alcohol or some kind of other addictive substance, so they have an understanding of, whether addiction is a problem for them, or they've, had addiction problems in the past. If you've had addiction problems in the past, the risk is higher. And that includes nicotine as an addiction. But, by the time we get to sort of middle and later adult life, I think many of us have a sense of whether that is an issue for us or not. And I think if it has not been an issue at that point, it's unlikely to become an issue. It's not impossible, but relatively unlikely.
Okay. Could you talk a little bit more about the, for fear of better words, like the buildup of marijuana as the substance in your system? Folks are curious, if I take it every day, is there that type of buildup, or similarly, maybe I'm more used to it and I need to maybe have a higher dose because my body has seen it every day? Could you speak a little bit to that?
Absolutely, that's a great question. So with chronic use, particularly high dose use, marijuana does stay in the body for a really long time, and it's really variable between people. So if you're a daily moderate to heavy user and you stop, you may continue to show positive urine toxicology results for even months. Some people do. It's not usual, but it is usual for those folks to have it positive for, like, say 30 days or so. It's pretty long where it hangs out. Whereas if it's intermittent, like light use, then usually that goes out of the urine, pretty quick. There's certainly a tolerance. People who are heavy smokers may need more. But some patients, and this is sort of more anecdotal than data driven, some of my patients will develop a tolerance to some of the psychoactive side effects, which they didn't want in the first place, and then still be able to use it for pain. So I've had people say that as well. But it's certainly possible that you would need more as time goes by.
Understood. That makes sense. Another question came in about, for fear of better words, scams, right? So are there specific brands for creams or things that patients should be wary of or similarly gravitate towards? Some folks are saying, you're saying topical creams are supposed to work, but they're not working. So maybe am I just getting the wrong brand or the wrong kind? And someone saying that it has something in it when it doesn't really. So how would you help patients to navigate, the type that they're considering, trying?
Yeah. So topicals may not work for everyone.
Okay.
So it could be that it's a good product and it's not working, but it could also be, so if it's a product that is from a dispensary that's registered in your state, that should probably be of good quality, but it depends a lot on the state by state laws. So you would need to, and I don't, know, they're all different. So if your state has a website that describes how they monitor their dispensaries, then that could be really helpful information. In New York State, our dispensaries are very closely monitored, so I would feel very confident that any New York State registered dispensary is giving what it says it's giving.
Okay.
Stuff that's available online, you want to look for that certificate of analysis. And you want to make sure that it's a recent certificate of analysis, not like 5 years old. That will show that they are analyzing their product and they're proving that their product has what they say it has in it. And then it's sort of like kind of some obvious buyer beware stuff. Like if it's very cheap, it's probably not good. Most of these products are not cheap. So that would sort of be another thing that I would keep an eye out for. And then you can go to the US Hemp Authority website, and they have some well thought of companies listed there. Again, bearing in mind that they are a self-monitoring group, right? They're sponsored by the hemp industry, but they also just have an interest in making sure that they appear to be legitimate. So it seems like their processes are pretty good.
Okay, that makes sense. And I think we probably have time for just about one more question. And there were several folks that were asking about this. You briefly talked about it, I think, in one of your slides, but if you could talk a little bit more about increasing appetite to avoid weight gain, right? So if marijuana increases, right? So I think a lot of folks, especially those that have diabetes or pre-diabetic or metabolic syndrome, they're going to be a little bit more concerned about, ooh, if I do some type of marijuana that's going to help this, is it a double-edged sword? Because now I might be, you know, increasing my appetite and now kind of going through this cyclical problem of helping one symptom, but now causing something else that's not helping another one.
Yeah, that is a very realistic concern. You know, THC is marketed, you know, for people with like cancer-induced weight loss, right? Like it's used as an appetite stimulant. So there's no getting around that, but that's THC. CBD probably does not have that much of an appetite stimulating effect. At least it's not, you know, used that way. So you could probably try that, and it should not have that kind of same degree of an effect.
Okay.
Yeah, that would be a little bit safer.
Okay. Well, that helps. And I think just in general, you know, we always say this at our organization, but consult your primary care physician to talk about it, especially if you're undergoing any type of new treatment plan, including medical marijuana. Start with lower doses, right, to see how your body reacts. And yeah, listen to what your body's telling you. So I think that's always very good advice to give. Dr. Robinson-Papp, thank you again very, very much for this informed conversation and discussion on medical marijuana. We did record this program, so make sure to get the recording posted on our website, shared through email, along with the slide deck. So I think a lot of helpful information. And obviously for folks that are joining us or folks that are viewing this recording at a later time, any other questions that are pertaining to this topic, feel free to reach out to us. You know, our contact information is listed below on this slide. And we are also going to be sending out a survey to make sure that this was an informative piece of information for everyone today, which I hope it was. I at least found it extremely educational. So thank you again for so much for your time. And thank you to everyone for joining us and relying on the Foundation for Peripheral Neuropathy for their educational help in the field of neuropathy. So thank you again.
Thank you so much, Lindsay. Thank you, everyone. Bye-bye.
Bye.
Bye.